Hello guys, welcome to my channel. This time we talk about a urinary bladder anatomy. So what's a urinary bladder anatomy? It's the hollow muscular organ that stores urine before it's expelled through the urethra. So this is the organ. So where the location? When the in adults, empty bladder lies entirely pelvis. In children, an empty bladder lies above the pelvic inlet. So you need to memorize it. And shape, when bladder empty, the shape is the pyramid. So we talk about the parts: abacus space, next superior surface, and two inferior lateral surface. So this is abacus. This is superior surface. This is inferior, two inferior lateral. You don't see two of them, but this is an inferior lateral surface. This is a neck, and this is a big symphysis. So we talk about relations. Abacus faces the pubic symphysis connected to the umbilicus by the median umbilical ligament. Medial umbilical ligament connect pubic symphysis to the abacus. Superior surface in male covered by peritoneum and also female covered by peritoneum. Related in male, related lobes of small intestine and sigmoid colon. In female, related body of ureter only, but in male related small intestine and sigmoid colon. So inferior lateral surface rests on levator ani and obturator internus. Base in male, ampulla of rectus deferens and seminal fascicle and rectum. In female, cervix, anterior wall of vagina. Neck in male rests on the prostate. You see, this is the prostate. And in female lies on the pelvis diaphragm, continues to the urethra. So this is the inferior lateral surface of the male. This is prostate. This is a seminal fascicle. You see them. And this is the rectus deferens. Yeah. So we talk about interior features or internal features. So we have regular folds that allow bladder expansion. And we have trigone, a smooth triangular opening between the two ureteric opening. So trigone is between two ureteric opening and urethral opening. This is a trigone. And we see in this picture this retrosal muscle, internal urethral sphincter, bladder, neck of the bladder. We see in the urethra. This is the urethra. An external urethral orifice. We talk about this muscle in the next slide. And we talk about blood supply. The blood supply is easy. You need superior and inferior physical artery. Where they come from? Superior and inferior physical artery. They come from internal iliac artery. So which defines drainage? From physical venous plexus. Where come from that physical venous plexus? They come from internal iliac vein. So the origin of the artery and vein is the internal iliac artery and internal iliac vein. And so we talk about a lymphatic drainage. So in bladder drain both internal and external iliac node. Both of them, internal and external iliac node. You need to memorize internal iliac artery, internal iliac vein, and internal and external. So before the nerve supply, we talk about micturition. So what's micturition? Micturition is the process of emptying urine from bladder to urethra. Urine from bladder to urethra. This we talk about this process. This process have two steps. Step 1 is the storage phase, and step 2 is releasing phase. So we talk about some physiology. If you need more, we we can talk about another video, but this time we talk about little bit. So urine come to the bladder as bladder fall, and the bladder wall it stretches. So during that storage, the trouser muscle relaxed, and internal urethral sphincter and external urethral sphincter are contracted. So we have a three muscle in here. So the muscle one is this trouser muscle. This muscle is relaxed. Storage time, this muscle is relaxed. Storage time, internal and external, they are contracted. Remember that. Step 2 is micturition reflex. When the bladder contains 300 to 400 ml of urine, stretch receptors in the bladder wall are activated. So that stretch walls send the signals through the pelvic nerves to the sacral spinal cord. The spinal cord then sends parasympathetic. It sends back to the bladder. So they send it, and the nerves sends back. So after they send back nerves, the trouser muscle contracted. Internal urethral sphincter and external urethral sphincter are relaxed. Oh my god. What happened after they relaxed? Urine flows out through urethra. So you need to memorize it when the muscle contracted and when the muscle relaxed. So we talk about nerve supplies. Nerves. So these nerves, they are contracted, the muscles were okay, and they are relaxed, the muscles were okay. So we have autonomic supply and the somatic supply. So we talk about autonomic. The first is the parasympathetic, the boss. So the parasympathetic, it contracted the trouser muscle and relaxed internal urethral sphincter. So what it can promote? It can promote urination. And a sympathetic come from T11 to L2. So what they can do? They relax it, the trouser muscle, and they contract the internal urethral sphincter. So they promote urine storage. So they are opposite each other. So this time we talk about two muscles. Where the external urethral sphincter, where it? We have somatic. So somatic, it can control external urethral sphincter. So these two muscles, the trouser and internal urethral sphincter, they are voluntary, not involuntary, and external is the voluntary one. I hope you understand each other. If you don't understand, repeat. The more you repeat it, the more you memorize it. Bye.